Hi, it's Trisha Wonderly with Dental Hygiene Excellence, and I'd like to share with you the Dental Hygiene Excellence philosophy, where we teach our hygienists how to test, treat, and repopulate. So we're going to start out with testing. This is a simple saliva test that's done in our office. It's a 30-second swish and spit. Once we get that sample back from the lab, we will have the report from the company that will tell us specifically which of the top 11 pathogens that cause periodontal disease are present in a patient's mouth and how much there is. It will also indicate which is the best antibiotic that they can use systemically to fight their particular bacteria. And then we'll also have a chart that will show us of the bacteria that are in their mouth, which systemic diseases could be affiliated with those. As our patients see that connection between what's going on in their mouth and how they are at risk for different systemic diseases because of that, they're much more prone to get their therapy taken care of. So we find that saliva testing really is going to take the guessing out of our treatment. And it's our responsibility as dental professionals to guide our patients toward the therapies that will lead them to less inflammation overall. And really our role, it starts in their mouth. So we teach hygienists how to provide personalized therapy for each and every patient that's individually based on their test results. So after we test, then we're going to go ahead and treat. And this second point in our philosophy of treating is multifaceted. It's going to be a non-surgical therapy for biofilm disruption that we do in the office, in addition to what the patient will be doing at home afterwards. So we teach advanced instrumentation with 5-tip therapy, as well as air polishing with either glycine or with erythritol, which is going to be the most comfortable and the most effective biofilm disruption that's available today. In addition to that, if a patient needs an antibiotic systemically, we will have them get that started right away when we finish our therapy that same day. And we will send them home with different products that are either antioxidant gels or rinses or a combination of both for optimal cellular healing. And then lastly, like all good hygienists, we're going to give our patients a really excellent home care regimen that they will be able to go home and implement right away. And then the third piece of our philosophy is to repopulate. Now, when we repopulate, what we're talking about is using oral and or systemic probiotics that are industry leaders that can really go in there and make a huge difference in what happens after our therapy. So probiotics are going to crowd out the bad bacteria that are in the patient's mouth and prevent them from taking over again. And it will repopulate it with good bacteria. If you think about grass, and we've got weeds in our grass, and we go in there and we put weed killer on it and those weeds die down, if we don't reseed with good grass seed, we're going to have weeds go right back into those places again. So we have to put good seed down that we want to see growing back into those areas. In the same way, those probiotics are hugely influential in the quality of the treatment and in the results that we get. So our patients really come out with the best outcomes we've ever seen before.